Live from Studio 5 in New York City, this is the News at 6.
It's Wednesday night. Good evening, everyone. I'm Ernie Anastas. Thank you very much for joining us again. And we start tonight with a story that impacts a lot of people, heroin addiction. It's still a huge problem in our country and here in our area. The numbers are staggering. Here in New York, heroin deaths outpace any other drug. And because it's cheap, it's easy to get. The problem is everywhere, and there is a light, however, to tell you about. As Linda Smith tells us tonight, there is a unique approach that might just help turn the tide. Watch this.
It is an epidemic. I mean, no doubt about it.
Fox News managing health editor Dr. Manny Alvarez has seen how heroin is destroying lives.
When you look at emergency room visits of drug overdose, those numbers are increasing every single day.
The reason experts say is that heroin is cheap and easily accessible. Plus, people who have become addicted to painkiller medications like oxycodone and OxyContin then turn to heroin.
They're using heroin as a replacement for a lot of over-the-counter or prescription pill use.
It's an absolute crisis here in Nassau County.
Hempstead Town Supervisor Kate Murray says the number of heroin deaths in Nassau County has more than doubled. Last year, there were 15 deaths. So far this year, 31. Plus, she says there's been a 10% increase in overdoses.
It is in the greatest neighborhoods. It's in the poorest neighborhoods. This crosses all social barriers, all social boundaries.
Just last month, the White House announced a new strategy to deal with what it calls an explosion of heroin use in the country. The government wants to focus on treating addicts instead of punishing them. That's the approach police are taking in Gloucester, Massachusetts. The police chief says the country cannot arrest itself out of this epidemic. So instead of prosecuting heroin abusers, the police department encourages them to call police, and then the officers will get them into rehab.
If an addict comes to the police station with their drugs or paraphernalia and asks for help, we do not arrest them. Instead, we facilitate them into treatment.
The Gloucester police chief says the police department is a safe haven, and his approach appears to be working.
We think it's been pretty successful. We've had 150 people placed into treatment in about 95 days.
Linda, we know it's a huge problem. Tell us about Gloucester. How is that working there?
Okay, now they say that it's working. So far, it's going really well for them. But, you know, you and I were talking about as far as relapsing. Because many times, many users, they end up relapsing. Well, the police chief there says if they relapse, they come right back to the police department. They get them right back into a rehab, because his philosophy is this. Look, the drug dealers, they're there. We can always arrest them. But if you don't deal with the users and get them off this stuff, the demand will always be there. That's right. Treat them, the demand dries up, and eventually, hopefully, the problem goes away.
Linda, we hope so. Let's continue to talk about it. Thanks for that report. Joining me right now is my special guest tonight, Maria Ulmer, Chief Clinical Officer, Summit Behavioral Health. Thank you for being here, Maria. You know, you were watching the story. We talked about this. You deal with this all the time. This is what you do. It's a huge problem, and it affects people, you know, that they don't realize it's in their own home.
Yes, this epidemic does not discriminate. Race, gender, and it's important to understand that it's in your backyard potentially. This could be your neighbor, this could be your postmaster, this could be your doctor. And it's important that we look at what the reality is instead of acknowledging the misnomers.
Yeah, and it's a progressive process here. Who's at risk?
This can begin especially with our youth these days, the adolescents, 12 to 17. But we're seeing the young adult population is heavily being hit by this epidemic, starting off with prescription pain medications, as we've talked, we've seen, and going right to heroin as it's more accessible, it's cheaper, it's $5 a bag. And we can snort, we can shoot, we can smoke, and it's something that is just now crossing all boundaries.
Yeah, when you're taking a prescription drug, you know what it is. You take heroin, you don't know what heroin is.
You don't know.
Right, you don't know what you're dealing with.
You don't know. There's no FDA stamp on that. There's no one monitoring it. And likely, it could be laced with fentanyl, which is a deadly substance to be playing with.
Okay, let's get to the, you know, we like to deal with the problem and the solution. How do we deal with this thing? Now, how do we solve the problem? How do we get to the source of why people are doing this?
Right now is the time to take action. So we want to educate, we want to provide training to law enforcement, to first responders, to families. We now have Narcan and naloxone that are offering the opportunity that if someone could be potentially in a fatal overdose, that if they are injected or nasally ingesting, that they are able to be saved. So we want to provide the community with the resources, as well as what are other options to help them overcome this addiction.
Yeah, help deal with
treatment.
Treatment, exactly. You know, the coping skills that they need to have to be able to handle this problem.
Yeah, we're ignoring the underlying issues if we just think this is a law or a civic problem in the community. This is something that each individual is struggling with, something underlying mental health, emotional distress, family,
that's
relationship
where you get
issues.
to it, exactly.
So those coping skills, that's the key, because if we look at that and help to identify what some of those stresses were and how we could overcome it without using, that helps us to take a different step moving forward, not doing the same thing and getting the same result, which is deadly.
I like that. It's an emotional problem. It creates a lot of issues, you know, for an individual and for family, but everybody's got to get involved, as you said, Maria.
Yes, the whole community.
Whole community, and government and schools and everybody has to pitch in here to get to the source of the problem.
Absolutely. So if we can band together, educating and providing training and resources and the treatment options that are available and accessible for individuals with or without insurance.
Let's do it. Let's make it happen. Maria Ulmer, thanks for joining us today. Good information. All right, thank you.